I love playing badminton, but I'm alone to play badminton. Okay, I asked every day I play badminton with my neighbor, and before 10 days she didn't came to play badminton. So I thought, like, as I don't have any other person, I went to her home. Her daughter opened the door and she said, "My mom is not well." Then I went to her and I asked, "What happened to you?" She said, already her face is like moon face and she's already becoming obese. That is the reason she accepted to play badminton with me. Okay, then she's so weak that she cannot do her household activities. So I said, okay, let's go to hospital. Then she agreed with me. Then we went to hospital. Then after seeing her, the doctor prescribed, she asked, like, what happened to you? You are using any medications? What are your past history and all? Then she said, I'm feeling so weak every day. Even my menstrual cycles are irregular. And by doing any activity, I'm feeling hypoglycemic and I'm having so many stretch marks and sudden weight gain as well as she's having, there are some more symptoms, hair loss. These are the symptoms, she said to the doctor. And doctor returned some investigations and we went home. Then I just asked her, like, are you using any medications again? She said, no, I'm not using any medications. But you know, right, recently before long ago, I was not well. I'm having some fungal infections. Okay, as my husband is a community pharmacist, her husband is a community pharmacist, diploma holder. She's having severe fungal infection. She asked him, like, I'm having fungal infection, I want to go to a gynecologist. But he said, hey, I am your husband and I'm having community pharmacist. And he just gave like one drug and he said it works like magic. Then he gave one betamethasone and one antifungal combination drug to her, ointment to her, and she applied, and within 10 days it worked so good. And she felt like her husband is so good. Then later she felt good, and after that she stopped using the drug, and after some days again she got fungal infection. Then again she asked him, like, let's go to a gynecologist. Then he said, why to waste money? Now anyway costs will increase. And he again gave another drug which contained clobetasone propionate, betamethasone as well as one antifungal combination. And she started applying it. And she applied it for 3 months. Whenever she's applying it, I don't know, everyone has this stigma, like in India more, maybe. They want their underarms and the genitals to look bright, maybe. That is the reason even she is developing this hypopigmentation in that area. She applied it for 3 months, continuously. And that's it. And I was like, okay, if you apply 3 months, then it should happen thinning of the skin and all, or something like that. But how? I observed like Cushing syndrome, symptoms on her face, moon face, everything. And according to her signs and symptoms, her menstrual cycle as well as the fatigue. Then I asked her, then she said she applied even inside the vagina. That is the reason, because she applied inside the vagina due to mucosal layer, more absorption. Next day when we went to the hospital, even the report shows increased cortisol level in her blood. And the doctor I just told all the story to her, and the doctor also said, like, you should not use over-the-counter medications, that to topical corticosteroids. Okay, myself Sowmya is full-time research scholar under the guidance of Ganachari sir. As my topic is topical corticosteroids, I saw so many stories, not only in hospital, outside the community. The one who is staying in front of me, my student, my friend, or anyone, even me, so many suggested me, as I am a bit dark skin, so many suggested me, use this cream, it feels better. So this is what happening in the community. As healthcare professionals,